also like to prepare the skin and the patient a little bit, because if I start with the V-actor, they adapt in a better way. So also for the V-actor, you have two different transmitters, a smaller and a bigger. And if you are working on the legs, I usually prefer the larger one, because then you cover a bigger area. We need, for the coupling or for the transmission of energy, we always need ultrasound gel. A lot of people, of course, ask if they can use oil or body lotion. We don't recommend it, because the handpiece will break much easier, because if the body lotion or the oil is going into the rubber pieces and inside the handpiece, it will break down. And on top, we know that ultrasound gel has the best characteristics for the energy transmission into the skin. Use a lot of ultrasound gel, because otherwise because it will dry a little bit, and then you have to take more and more. So, it's okay?
Yes.
Okay. Okay, I would prepare the backside of the leg. In the protocol there are recommended, I think, 5,000 pulses per area. You can go with 35 hearts, that's the highest. In that case it makes sense. And then you will also see that 5,000s are gone very quick. So in what we do, I always have one hand on the patient. It's more comfortable, and then I work upwards. And then I start in the upper part, and always with the pressure upwards. You can also do long strokes.
But it's not uncomfortable.
No, this is really comfortable. And the good thing is, if you start with the reactor, the patients start to adapt a little bit. And then because this pain relieving effect you will have all the time, because you activate those pain fibers, okay? So they will tolerate the acoustic wave much better. So this would be 5,000 pulses for one leg. So of course you always do both legs in one session, huh? We have 3,000 pulses between the knee and the buttock, okay? And you see here we have straight lines, we have also circles. They recommend a tip. The tip with the red one is the same tip like this one that I showed you before, this one, okay? But depending on what is your main problem, if it's more fibrotic or more water, I would start with this one, okay? If you have here like fat depots like we know, or here in this area we have fat depots like we know, I would start with the golden one, okay? So I will give you now an idea what I would do in the different cases. So if I would have a water problem or like a fibrotic problem that is going all over the area, okay, I would start with this one, okay? The treatment says 3,000 pulses. So what you can do the step twice, first with the one, then with the other, or you can split, okay? You say, I do half with this applicator and the other half with the other. So what I do then, I lower here the pulses to 1,500. And after 1,500 it stops, and then I switch to the other one. This is what I would do. And bar, recommended bar is 1.5. For demonstration, I lower to 1, okay? But normally I would go with 1.5 or even higher, up to 2. Here I really go with the handpiece always 90° to the skin surface. I always hold it like a pen because then I have a very good feeling. And I go with a little bit pressure into the tissue. If you are just moving like here, like it feels like ants, like little ants. You know, that's not very nice. So it's also for the patient. It's okay?
Yes.
It's a little bit more comfortable if I go into the tissue. And mostly I have my other hand directly here, and I also guide my handpiece that I can make straight lines from the knee to the buttock. And then I go line for line, I go up. And I go always up because I always go in the direction of the lymphatic flow. I never work downwards, always upwards. First reason is the lymphatic flow. Second reason is also because we have the hypothesis that if you are working in the direction where you want to get the shaping effect, that might is benefiting. So in here I work on the whole area and try to cover every spot. And you see I'm working more or less dynamic in the area to cover the whole structure. And then what we can also do, we can go here in lines from left to right. And also line for line, we go upward. If you have somewhere a fibrotic spot, then of course you can go also like this. So this were 1,500 pulses. Yeah.
You can put more pulse to get.
Of
more
course
time.
you can. You can also do the step twice.
Okay.
Yeah. But if you do the buttocks also,
Okay,
normally we do
more,
also the
yeah.
buttocks. We do 3,000 and 3,000.
Okay.
This is all in all 6. Normally that's enough. But if you think you should repeat one step, then repeat it. Okay. I think it's more better to have some more pulses than not enough pulses. Yeah. But this here in the machines are always the standard protocols from the average numbers from the different studies. But I always say it doesn't mean that this is a fixed protocol that you have to take. This is just a recommendation that you can adapt to the patient's need, okay? Okay, now I have the golden one, the one that is really activating fat depots. And let's say she has here in this region, she has like a fat depot. So what I would do, always like a pen. So this feels now a little bit different. And I always go here with very little strokes. So and this is really, then I really go here and work in this area where we want to get the change. But of course you could, if you think it would make sense to work also with the golden one, in a bigger area, you can of course do also here the full lines, okay? That's absolutely also working very good. You see here now we get a reddening very quick, huh? So this one is really much more aggressive to the skin. And it seems to be that this one here has very good effects.
And what is the sensation now for the patient?
This feels like getting inked. Getting inked, a tattoo.
It's the protocol, but if you want to go a little bit higher in pressure.
Exactly. So if you follow the protocols, you will have a good result. Okay, but if you want to have a little bit advanced treatments, then you should add more knowledge. But if beginners with the machines just follow the protocol, they will get results. And then for additional steps or advantage steps, the other transmitters, more knowledge, little, this is like a little bit the secret behind it. Huh? Okay, that were all in all 3,000 pulses, but this was not so much. Huh? So depending on the leg, you can higher a little bit or do the step twice. But if you do both back sides and both buttocks, it's all in all, it's altogether 12,000. If you start with both, with the back side, I do V-actor here, and then depending what I have, I go first with this applicator, backside buttock. Then, if it's necessary, I switch applicators, and then I do it again. Okay, but it depends on the situation what we have. Yeah, this really depends. But the treatment itself is important that you are always working with pressure up towards the lymphatic flow, yeah, and that you have a little bit pressure inside the tissue, because this is much more comfortable for the patient, and 90-degree angle, that you are not have an angle in the surface, that the full transmitter is on the leg. So this is what is important.